Joining us right now to discuss this topic is Democratic Congressman Ruiz of California. He's a former emergency room doctor. Good to see you again, Representative/Doctor.
It's nice to be here.
Yeah. So you were just appointed to the House Energy and Commerce Committee, where you'll be dealing with health care policy. What's your thought here? What do you think you can do at this point to stop the repeal or changes of Obamacare that have been discussed so far that you disagree with?
One is vote against every measure that they do that will produce uninsured people and raise healthcare costs for everyday Americans. Two is to let the constituents and the American people know how their plan is no new plan, just old ideas that have failed in the past and that will actually harm them or their family or a friend that they know who may have pre-existing condition, who are women and who are young, who rely on their parents' health insurance, and who are senior. In other words, who may need nursing home care or have saved $2,000 or $3,000 a year on pharmaceuticals due to closing of the Medicare donut hole. So there are real consequences to real people out there.
You have offered in your conversations some, if you will, helpful criticism to ACA, Obamacare, and one of the ideas that you've discussed is how to help small businesses. Describe that.
Yeah, so, you know, one of the things, what we need to do is improve the Affordable Care Act, not repeal the good stuff in it. So one of the things that we can do is to provide an exemption for small businesses who are on the verge of bankruptcy or who have proven characteristics of economic hardship, so they don't have to pay the business. But what we really have to do overall, Richard, and this is very important because if we repeal the Affordable Care Act, premiums and health care costs will skyrocket. They are already out of control. They diminished in their rate of rise, but if we repeal those measures, they will skyrocket. So we need to address the root of the problem, and that's overall health care costs so that American people don't pay exorbitant amount of money out of their pockets for their premiums. We need to protect Medicare, or else seniors are going to pay a lot more out of pocket with the voucher system. We're going to be able to reduce costs by allowing Medicare to negotiate drug prices with pharmaceutical companies, and also we need to make sure that people have transparency in what healthcare costs really are when they go for a routine procedure. For example, a colonoscopy.
Right.
You can tell whether one hospital is charging 5 times more than another hospital in your same neighborhood, and then you can make better choices.
Representative, you were very aware of the vote that happened on Friday, the beginning, if you will, of the process of the idea of repealing Obamacare, ACA here, and it was voted down by one specific Republican, Charlie Dent, who we spoke with yesterday, and he said, it's fine that we consider this idea of repealing ACA, but we have to have a replacement first. And he went through some of the ways that he thought you could move forward. Keep certain parts, as you're stating, fix certain parts, and repeal other parts. Are you working with any of your colleagues across the aisle, like Charlie Dent?
Yeah, you know, I extend my hand to work with any Republican who wants to have common sense resolutions and ideas that will put people above partisanship and solutions above ideology in order to get more people in health care and get them to see their doctors, live a better life. But oftentimes it is very difficult to do because...
Have you spoken with somebody across the aisle who was... How'd that conversation go?
Oh, I have spoken with some Republicans, yeah. Especially the physicians, to talk about what can we do. And here's a common point that we need to address. One of the things that we can work together is to increase the amount of providers that we have in our country. What people don't realize is that we are very severely short on the amount of physicians per population. And I know this by my own life experience. I grew up in Coachella. My parents are farm workers. I lived in a trailer park growing up. Till this day, it is very medically underserved right here in my district. There is one physician per 9,000 residents in certain parts of my district. That statistic is staggering given that the recommended number is 1 to 2,000. So we need to do what I've done here in my district, which is create pipeline programs for underserved community, youth who want to serve in underserved communities, communities. We have to expand medical schools and seats and create residency programs in those communities so that young people who want to be doctors can get educated and train in those underserved communities.
And be like you. That great story of becoming a doctor. Congressman Dr. Raul Ruiz of California, thanks for stopping by.
Thank you for having me.
You bet.